Um, the Mental Health Board, who we are. The Sonoma County Mental Health Board is an advisory board empowered to listen to the concerns of our constituents and to help formulate policies that offer a consistent continuum of care for all those with mental health challenges. We are further empowered to advise the County Board of Supervisors on the mental health system of care. We support reducing stigma for individuals needing all levels of mental health care in all communities in the county. We support treating each person with compassion and respect, regardless of gender, sexual identity, or cultural or ethnic background, and acknowledging the influence of individual lived experiences. We acknowledge working with the local mental health system to eliminate racism from our minds and hearts and ensuring that our policies are equitable and benefit underrepresented communities. We support acknowledging that environmental factors can increase mental distress and supporting efforts to reduce such stressors. We support providing support to the families of those with mental health challenges. The Sonoma County Mental Health Board collaborates with the Behavioral Health Division of the Sonoma County Department of Health Services to increase public and professional awareness of individuals with mental health challenges. We strive to influence positively the mental health system by listening to public input and working with behavioral health services to create policies that will offer hope to individuals living with mental illness and to their families. So I'm going to go ahead with the roll call. And I'm not sure that I have the correct. So if I call somebody's name and they're not there anymore, then just let me know. Annabelle Nygaard. Betsy Chavez. Bob Cobb.
Sure.
Carol West.
Yeah.
I'm here, Kathy Smith. Marianne Swanson.
Present.
Michael Johnson. Patricia Gray. Peter McElweeny.
I'm here.
Thank you. Peterson Pierre. Bob Hales was excused. Vanessa Nava.
Here.
Okay, and I believe that then we have just vacancies in District 2, 4, and 5. And we have a new Peer Coalition intern, Maddie Cottrell. Are you here?
I am here.
Perfect. Okay. So welcome. Okay. Do we have a quorum? 1, 2, 3, 4, 5, 6. 6 of us, and I think we need 7. So we'll see if somebody else shows up before we approach approving the minutes. So that is going to bring us to the Consumer Affairs report. Kate, did you have a report?
Yes, I do. I'm trying to turn off my telephone, which does not, I can't seem to get it off. Hang on just a second. I don't want it to. Well, I'm just going to leave it here. If it rings, it rings. Yeah, hi everybody. I would turn my my camera on, but I'm sitting. I don't have my lighting up, and I'm actually sitting in a pretty dark room. So I was going to talk a little bit about mental health recovery oriented language today. Because, you know, words matter and labels stick. And I've been doing this work, you know, either as a peer or on the other side of the table for about 30 years now. And I hope it's getting better, but I've seen many situations where people get diagnosed as something and nobody really questions it, which I know it's good practice to keep re-examining and going back, but sometimes that doesn't happen. And someone who gets labeled may have the same label. It may not have been a true label, or they may have changed radically. And sometimes, a lot of the time, I don't think that gets picked up. And, there was a time, I had this one day, I lived in Sacramento, which was extremely hot, and I was in very poor shape in terms of mental health. And I had a job interview. I was really looking for work. And so, I put on knee socks, and I don't even know, nobody had been wearing knee socks for like 20 years, but I was wearing them, and this kind of ugly skirt and a misbuttoned shirt, and with my hair was a mess, and I hadn't bathed, and my makeup that I tried to put on was just all over. And so, there I went up to the office, also sweating like crazy because I'd been on the bus. And I went up to the floor, and I went up to the the secretary, and I said, "I'm here for my interview." And she looked up at me and said, "Honey, it was yesterday." And, instead of a job interview, if I had been to see a psychiatrist that day, I think I probably would have been branded low functioning, and maybe a couple of other things. But once I'm branded low functioning, if that can stick with me and keep going, and that would change through the mental health system how people see me. It's easy to go, "Oh, they're low functioning," and I'm in a hurry. I'm a nurse, and "Oh, they're low functioning. I know they can't do as much for themselves. Therefore, we will place less confidence in them." So words matter. What we decide to name and tell about people is really not helpful. A person who is labeled a certain way, say low functional, can very well start living out that part. They believe it, and people around them are doing for them, things that could be done by themselves. And so it's very easy to adopt what's called learned helplessness. And that's when people go through the system and they learn that other people can take care of their needs, which of course means they aren't able to take care of their own needs and learn all the things they need to go through life, like all of us. So there are two parts that I want to talk quickly about. One is the traditional clinical or medical model of language. It has an element of one up, one downness that is judgmental, stigmatizing, creates a power differential, and places mental health psychiatrists and clinicians in a role of superiority. I'm in a tussle right now with the doctor about medication. And I went in the other day because I've been reading up, and I said, well, my research that I'm reading, and he had this laugh come out, and he tried to stop it, and he snorted, like, you think you do research. And I tried it again a couple of days later, and he did a similar thing, but a little different. So it wasn't just, a one-time thing. And I guess as a psychiatrist, I have a master's degree. I guess he just doesn't imagine that someone like me could actually do research. So that's the kind of thing I'm talking about. Traditional, it can lead to that one up, one down thing. I'm the doctor and you're not. And we internalize that stigma. So then we believe that, yeah, the doctor certainly knows what's best. So, and that's nobody's fault. That's what's taught. That's what's learned, that's in the system beyond, before people ever get to be doctors or psychiatrists or nurses, or that's what they come out knowing. And I hope that's changing too. I had a friend who got out with her master's degree in counseling a couple of years ago, and she's a strong, a strong believer in peer support, and told me that it had been the same, that the same language was being used. And so talk for a second about the recovery model language. And it's to speak to and about people with mental health challenges with respect and to treat them with dignity. It builds on their strengths and the right to self-determination of every person. So, and language matters. And here's some maybe transformational choices one could make. The decompensated, which is something we hear when somebody is, having difficulty and maybe is exhibiting some so-called symptoms that we don't like, but when you say decompensated, what does that mean? And, I say not doing very well. So I'll say John's not doing very well. He hasn't slept in 3 days, which says a lot more than John's decompensated. And then, which it's not real helpful. Another one is manipulative, which I really hate, because people get called manipulated all the time when they're really in dire straits and really need help. And it's that he wanted to commit suicide last month, and he's manipulating us. Well, so another definition of that would be to get one's needs met. If I'm really in trouble, I'm going to get my needs met any way I can. So anyway, these things are up there. These words are up there. I know. Non-compliant. Is somebody non-compliant, or do they just not want to? I don't want to take that medication. Well, maybe I just don't want to. Maybe I'm not non-compliant. High functioning, low functioning, schizophrenic rather than a person with schizophrenia. Mentally ill, which I noticed is in the reading at the beginning of the meeting. Most, not all, but a lot of peers do not use the phrase mentally ill. I say I have a mental health challenge or have lived mental health experience. So anyway, and yeah, there's a couple more. Unmotivated. I don't want to. Maybe I'm very motivated when somebody gives me a guitar, but I'm not motivated to go do whatever you want me to do. I don't want to. Instead of client and patient, the name or the person I work with, rather than, at lumps them in, you're a client or you're a patient. Somebody's chronic. Well, maybe they're chronic or maybe they're in recovery. I've seen lots of chronic people who, healed a lot, and one of them myself. And so chronic, I'd like to say, is in recovery, and delusional sees or hears things that others don't. So that's just, maybe some alternatives. And that's it.
Thank you, Kate.
Sure.
Yeah, and Kate said something really important. Words matter, labels stick. The next moment in our board meeting here is public comments and concerns, accomplishments, and the impact of racial disparities. I'm going to start this section out saying, we don't have time for a long conversation here tonight, but I shared with the mental health board, and I'm sure that that many of the rest of you have seen the article that was in the Press Democrat about Black people of color, not seeing our county as a good place to work. And the mental health system, the behavioral health system, was mentioned as being, the incident was one where a person who was seeking therapy said, "I don't want to work with her, she's Black." That is a very racist, insensitive thing to say, and hurtful. the flip side of that is, would a therapist want to work with somebody who does not want to work with them? And would therapy happen in that situation? It's a difficult conversation, and a difficult, it's difficult to address. And I know that Carol and I were at a meeting recently where I know that not only the county, but many other organizations within the county who were also at this meeting are looking at addressing how do you address that sort of situation. It really comes down to client rights versus, employee or therapist's rights. So it is sad that it's a situation that we are still having to deal with in our county, and it's affecting our ability to hire good people from outside of the county. So I'm going to end my little bit there with repeating Kate's words. Words matter, labels stick. Be kind and careful with what you say. Okay. Are there any other comments? Do you see anybody, Tori, with their hand up? Okay. Having no other comments, then let's go on to our special presentation. And I know that Carol and Marianne have been working on this, so I'm going to let you, Carol or Marianne, take over this part of the meeting.
If I could just say one thing, Madam Chair, all of the credit for tonight's program is for Carol. And she deserves, if not a real applause, a virtual applause for all of her contacts, people, and getting this all lined up. So thank you, Carol.
Thank you, Carol. I did notice a lot of emailing going back and forth with her name on it. Okay, so Carol, you're on.
Okay, well, thank you. So just FYI for people who don't know, each of the districts has 3 slots for representation on the board. So there is still an open for District 2. And just wanted to check, perhaps, Tori, I'm not sure if you can see hand up, if there's anybody in the audience who is a panel member, if you can just put your hand up or put your name in the chat, and we'll have you moved over to the panel. And I would like to give Alison Murphy first slot, since I do know she has a conflict. So would like to introduce Alison Murphy, and she has several hats on in South County. So I will let her share what she wants to share about her services in South County.
Hi, everyone. Thank you for having me here today. I really appreciate it. It's nice to see some familiar faces and also some new faces. I am a clinician and CEO of Mother's Care. And Mother's Care is a perinatal mood and anxiety screening, assessment, and treatment program. We work with OBGYNs and pediatricians, and we are partially funded by Providence hospital system. And so we work not mainly, but predominantly with Providence docs. And so what we do is those doctors, they screen women mainly. We would screen men if they went to the services that we are screening. We screen them, and they are, then if indicated, we can reach out to patients or people that are, where their questionnaire indicates it, and we can offer them services. And one of the great things that happened last year was that we were awarded additional funding in order to see people. We traditionally had seen people, had funding to see people for 2 counseling sessions, and now we can see people for up to 6 counseling sessions if they qualify for those services. We take Medi-Cal, we take some insurances, and as a commentary on our mental health system and our insurance system, the predominant people that we see the most who are in need of 6 sessions are people who are underinsured. So they're people who have private insurance, right? And that's that gap where maybe their deductible is so high, maybe they have a $9,000 deductible, but they need therapy. And so these are it is an area that I am very happy to say that Providence has responded to. In 2020, we doubled the amount of people that we saw. The need is so high. Recently, I saw a result of a survey that 93% of women that were surveyed reported that they were reported burnout in the last year. It's no surprise, but that's a pretty high number. And so it makes sense that we saw more people were referred in 2020, and that's continued into 2021. As I'm sure that some of you were following some of the debates that were happening in DC around parental leave. My view is that we don't treat young families very well in this country. It's very stressful to have a baby. Women are expected to, women and families, but women in particular are expected to do a lot. And people are really struggling under those expectations and the weight. And so we at Mother's Care are doing what we can to support women and families during pregnancy and postpartum. So some of our challenges are probably with everybody in the mental health field right now, finding mental health providers that have a specialization in this area. And also then that really we are so grateful that we can fund up to 6 sessions in those areas, but sometimes more is needed, and we do what we can to make that happen. We get pretty creative over here to make sure that people get services that they need. Let's see. So the other hat that I wear, besides being a clinician and CEO of Mother's Care, is I am the co-chair of the of CHIPA, which is the Community Health Initiative for the Petaluma area. That's our health action chapter down here in Petaluma. And so over the last year or so, we've done a variety of things, but some of the highlights are we focused on inclusion, equity, and race relations. We brought in consultants. And one of the things that I'm really glad about is, even though it was great to meet with his consultants and have these wonderful conversations and break down racism and equity and inclusion. But one of the things that we've done ongoing is that at every meeting, we have a focus on diversity, equity, and inclusion. And so what we're trying to do is just have that education and that understanding throughout each of our meetings, rather than making it kind of a one-off. And I'm really glad that that's something that we're doing. We start every one of our meetings with a mindfulness moment, just to remind everyone that, you know, a mental health tool is available to you at any time you need it. And then one of the more recent things that we've been doing is focusing on the Youth Truth Survey. Many of you here probably know about that survey, and it was results of a survey that was done in 2021. I'm really impressed by that. It's a quick turnaround. 23,000 students in Sonoma County were surveyed, 90 schools, 19 school districts, and the mental health findings were pretty distressing and probably not that surprising to people. 70% of high school students reported feeling depressed, stressed, or anxious, and 50% of middle schoolers felt the same. And so at CHIPA, and with this really, alarming data, we went out and engaged with superintendents. We have school board members that regularly attend our CHIPA meeting, and we are, one of the challenges that we have right now is getting that information into the right hands. And then also our goal is to work with our school system here in Petaluma to see how we can support their efforts. And so recently what we did was there are 2 new positions and they're probably the same in many school districts around, but they are funded through recent COVID money, and they are wellness and family engagement coordinators. And so what we've done recently is reached out to them, made them aware of this survey, and then also are here to engage with them in the way that makes sense that we at CHIPA can do to support their efforts. So that's an ongoing effort on our part. So one of the things that at our next CHIPA meeting, our focus, we're moving our focus a little bit more towards drug and alcohol use in our community. Unfortunately, we've had more than one death, youth death, but other deaths due to fentanyl. And so some of our focus is now going to turn to that. And so that's where we are with CHIPA. Does anybody have any questions for me? I'll do my best to answer them.
Not at this point.
Okay.
Okay. All right. Well, thank you very much, Alison. Really appreciate that update, and would highly recommend anyone who's interested in South County attending the CHIPA Mental Health Collaborative. It's a really awesome way to get to know what's going on in South County. So yeah, thank you very much.
Yes, thank you for that, Carol. Yes, anyone who is interested, please join our meetings. The mental health substance abuse work group meets the 3rd Thursday of every month from 12 to 1:30. And then we meet, except for on the quarter, we have a general meeting. And so if you're interested, I'll put my email in the chat, and please contact me. We'll get you on the list.
Well,
Thank you very much.
Thank you.
okay. All right. Next in my little boxes, I'm just going by the boxes that I can see. Jules Pelican from Cots, or Mary Isaacs.
Hi, nice to be here with everyone. Thanks for the invite, Carol. So Carol, my understanding is that you would like me to sort of generally talk about what kind of mental health services are happening at Cots, and then also where the need is. So Cots serves homeless individuals and families here in South County, but really throughout Sonoma County, but we're located in Petaluma. We have shelter programs and housing programs and lots of supportive services programs. There's some things that I feel like are going really right at Cots recently. We're making some changes that are feeling really good in terms of this mental health topic. One is that Providence has funded a social supports manager, and without Erica Chloe's support on this never would have happened. And I'm guessing that might be true for other people in this room. Is that, yeah, Allison's nodding her head. It's like, Erica Chloe, you go. So Finn Robertson is our social supports manager, and Finn provides individual and group meetings. He's not a therapist, he's a PsyD, but he's not doing therapy, but he's offering mental health services meeting people completely where they're at, both internally and also literally going out to the smoking section if that's where people are hanging out, or hanging out in the lobby and just seeing what's up. And what we found at the Mary Isaac Center is that makes all the difference, right? We can have the most brilliant minds on the other end of a telehealth call, and our clients are not showing up for telehealth. This is not, it's not a way in for them. However, if someone's hanging out in the smoking section, they're likely to talk to them. So this is our first year of this position. We couldn't be happier. And, Erica and I are going to work together to make sure that we can compile data to show the good work that Finn is doing and the impact on our participants. Another thing that's happening right now, and I'm sure Elise will talk about this, is that the SAFE team is up and running in Petaluma. And oh my goodness, what a game changer for us at Cots. And we're really working out a lot of kinks with SAFE and with the PPD, like what is an appropriate SAFE team call, what's not, what is PPD and SAFE. So, we're all kind of in this beautiful learning curve together, but the presence of the SAFE team, and Elise, you can share this is making a tremendous difference, both for our staff and for our participants. So super grateful for that addition. We also have a new board member at Cots, who's Susan Standen, who I wasn't sure if maybe Susan might be part of this group, but Susan, I heard Susan, I probably at the beginning of this year, Erica was at that meeting, yeah. And she just changed my world. She really rocked my world. And so I contacted her, to talk about strengths-based services. How can we make Cots more of a strengths-based organization, rather than like a needs-based or a barriers-based, and so much of what I was seeing in forms were like, what are the participants' barriers to housing, rather than what strengths could help this participant achieve permanent housing. So I literally went through and I have changed so many of our forms and assessments based on the conversations that I've had with Susan. And she did just join our board. It was about a month ago. So I'm really looking forward to having more of her voice in my ears to help us really continue to guide things in that direction. Things that are still hard for us are rampant mental health issues amongst the homeless. So many people come to us at the Mary Isaac Center who are really out of our scope. We would love a stronger presence from the IMDT team or IMDT. I believe that conversation is now starting to happen. They haven't really served South County consistently, but there are new projects coming on at Cots, and IMDT is now joining into one of our weekly meetings because we could use them. We could really use them. So if anyone has any pull with IMDT, you can, mention that. Other things that come to mind that we could use in South County is like a sobering station or some kind of detox, if it was adjacent to some kind of medical care center, we could really help people safely detox and start addressing what's behind substance use. There's a lot of need, and there's also a lot of positive stuff going on, but I'm really grateful and interested in this conversation. I'm happy to answer questions. We're also hiring a case manager. If anyone knows a wonderful person who could be our permanent supportive housing case manager out in the community, I need a strong, solid being for this role. So.
Okay. Any questions for Jules on Cots and we have a quiet audience today. But I'm really excited to hear about the good things that are happening and some solid ideas about what's needed, because I think that's the kind of framework for strength-based is that if we ask people what they need, they know what they want. And Mary Isaacs and Cots know what they want. So thank you for that.
Thank you.
Okay. Very good. Well, thank you very much. And the next person I can see is Elise Hempel from Petaluma People's Service Center.
Hi, Carol, and thank you. Thank you for having me. I was just looking back on my calendar, and it seems that I often speak at this calendar meeting because it also overlaps with my board of directors. So I will have to drop off a little bit earlier, but thank you for having me. In the mental health arena, for those of you who don't know Petaluma People Services Center, we're a suite of 70 programs that are provided in our community. A lot of them in Southern Sonoma County, but more and more throughout the entire county. And our program suite covers the whole range of mental health, youth programs, housing, employment programs, senior services. And then we also, in our spare time, run a production farm. So we are really focused on getting nutrition to residents in our community. So in our behavioral health department, we have continued to see a lot of growth. We just announced yesterday a partnership with the Boys and Girls Club in Sonoma Valley. And we will start providing Girls Circle and Boys Council in Sonoma Valley Boys and Girls Club free of charge to any of the residents there. We were able to secure a grant through the Catalyst, and we're excited about that. When we talk about concerns, and one of the things that is the biggest concern is once we start to do this kind of programming, where those individuals who recognize that they need more intensive behavioral health are going to go is always a concern. And so we're starting to look at how we can build more capacity, not only in Petaluma, but in Sonoma Valley, because there is a lot of gaps in services there. But we're very excited to launch that program. One of the things that we did shortly after, well, it was 2 days after we started the shelter in place, we also had to close down our congregate dining site, which is where we serve about 60 seniors a day, or serve 60 seniors a day with nutritional meals. And we had to tell them that we were no longer going to be doing it in person. And the seniors said, we love our meals, but we really will miss the people. We need that social emotional support. This is what you're always telling us why we come to the senior cafe, Elise, and now you're telling us we can't come. And so on the fly, we built a program called You're Not Alone. Today, as every day, over 3,000 seniors are getting a call from 3,000 volunteers every single day. Silly me, I made a commitment to, when we launched the program, to do a question of the day. And so every day I have to come up with a question of the day that the seniors can actually, that the volunteers can actually ask the seniors. And so it's covering the entire, it's wide. We probably get 4 or 5 referrals from Kaiser and Providence and the health centers every day for more people into that program. And so in my mind, that need for addressing the social and emotional connection as people continue to age. And I think one of the things that we all are recognizing as we're kind of coming out of COVID is seniors who were at home didn't just age 1.5 years or 2 years or however long COVID's going to last. What they've done is they've aged tenfold. A senior who was frail before COVID is extremely frail now. In fact, they're so frail, they're not going to be coming back to our congregate dining. They've been added completely and full-time to our home delivered meals program. And so I think it's important for us when we think about mental health, we have to think of all the different places and all the different connections where mental health services can be provided and delivered in a creative and interesting way. One of the things that also happened during COVID, which has been pretty exciting, and I actually have exciting news. So I joined a large collaborative led by a Golden State Warrior whose family members have severe and persistent mental health issues, and he's lived his entire life with parents who have mental health issues. And so he's helped the Golden State Warriors focus on building awareness and campaigns around behavioral health. And so for the last year, this collaborative has been working. And on December 4th, it's Mental Health Day at the Golden State Warriors. I'll put the link into the chat group. There are going to be partners that are outside of the new Golden State Warrior Stadium that are talking and sharing information about mental health and behavioral health programs throughout the Bay Area. You can buy the tickets. The tickets are a little bit of money is siphoned off. They're gonna send it out to the partners that have been working on this project. And you'll also get a Golden State Warriors first inaugural behavioral health awareness t-shirt with your ticket. So I'll put that link in there. It's so exciting. I'm very excited about that. And we just got the date yesterday. So it's December 4th, which I think is a Saturday, and it's the Spurs who they're playing. But we're looking at building more and more programming with that. To issues and things that we're seeing, we have been running the bulk of a lot of the rental assistance programs, either through Petaluma, the city of Petaluma, then the county through the CARES Act, and then the CDBG, and now the Emergency Rental Assistance Program. And we take extra care to make sure that we are not just providing rental assistance. We're making sure that we're providing an opportunity for these individuals who are calling and needing help with assistance to also know that there are other services available to them. So we have built in a whole resource network of connections for individuals when they call. Sadly, we are spending a lot of time with people who are extremely desperate and have never ever have felt so desperate. And that desperation comes with a lot of sadness, a lot of anxiety, and they just don't know how to struggle through all of that. We are excited that on July 1st, we made our commitment to launch the SAFE team. So a little bit about the SAFE team. In the July of 2020, the George Floyd incident really focused everybody's attention on community and policing and how policing was happening in communities. And here in Petaluma, at all of the city council meetings, and whenever anybody would stand up and speak, it was the youth who kept coming to our city council meetings saying, we need to look at the CAHOOTS model in Petaluma. We need to look at the CAHOOTS model. And so, of course, we all looked at the CAHOOTS model. And the city of Petaluma hired a consultant, and the consultant came down and did about a 4-month evaluation about how we could provide in Petaluma specifically a crisis intervention team that would respond to 911 calls that came into the police department and or the fire department to better meet the needs of our residents when they didn't necessarily need a police officer with a gun showing up at the door. What they needed is somebody who was trained in crisis intervention, who had beside them an EMT who could help make some decisions on health if they needed to be made, and was capable of helping individuals understand that there were solutions, and the solutions were not necessarily linked to a 5150. I am proud to say that we have not had to call back up for a 5150 since we started the program in July in Petaluma. Individuals are voluntarily asking to go to the CSU, the Aurora Center, to Petaluma Valley Hospital, Memorial. We have one person early on. It was a young girl. She'd attempted suicide. Her mother shared with the EMT that she had a mental health diagnosis, and her psychiatric support was based in San Francisco. We got permission to speak to the physician. The physician said, if you get this young person down here, we will get that person the medication that they needed and some of the supports they need and be able to get them back home. So we got permission to actually drive this individual to San Francisco. 3 days later, she was standing in our lobby registering for our youth employment programs, and has been thriving ever since. And so So I think that that's one of the things that we're learning with the SAFE team is there's so much more that we could be doing when it comes to mental health. Many of our crisis intervention individuals have lived experiences, and that really resonates with the people that they're responding to. Because of that success, we launched we did 2 weeks of training, and on Monday last week, we launched in Roder Park, Cots. So they also have a SAFE team. And when the SAFE team's not responding to these 911 calls and calls from the police department, they're also doing community outreach. They're doing community outreach to those who are unsheltered. We recently had a incident where a anonymous tip was made for a bomb at Kenilworth Junior High. The SAFE team was there on Monday when the youth showed up to make sure that kids were not fearful to go on campus along with the police department. So it's been a great way to learn the processes. I'm not going to take 100% of the credit. I often say it's better to be lucky than good. We were able to hire Manning Walker, who had been a EMT and a crisis intervention, and then a director of programming at the Cahoots model in Eugene. So he brings a lot of experience and fresh eyes and ideas. I think one of the things that we all learned early on, he spent a week with our dispatch. And one of the things that has happened here in Petaluma that has really kind of changed how everybody responds is that when a mental health call comes in and somebody is worried about a loved one and they've made that 911 call, when dispatch gets that call and has to send out the SAFE team, before the SAFE team, they would have said a possible 5150. And when a police officer hears that, their natural reaction is to get a little amped up. They may be walking into a very serious situation. Now, after the 911 call comes in, it says a SAFE team call with possible police backup. Nobody gets amped up. Nobody gets to a point that they're anxious about what they're walking into. And it's really changed how everybody is responding to those types of calls. So those are some of the things we've learned from that. And we continue to learn and we continue to grow. In Petaluma, we're doing 24 hours a day. In Roder Park and Cots, we're noon to midnight, and we'll be going to 24 hours a day, probably in March of 2022. So that's, we've got a lot going on. We combined our youth employment, our youth programs and our counseling programs, and they now are the Department of Peace. So we continue to do everything we do. Last year, we served 36,000 residents in Sonoma County.
Amazing. Oh my goodness. Oh gosh. All right. So that is a lot of things happening at Petaluma People Service Center, and thank you very much. We know that the engine behind that is. Thank you very much for holding all those many pieces together, and very exciting about the SAFE program. Okay, so I will pass it on to Erica.
Hi, everyone. It's nice to see everyone. And you can hear me okay?
We can, yes.
Okay, good. The headphones are working. So I was trying to figure out how to nutshell a whole bunch of things in 5 minutes. So I will do my best. And I thought I would first just start to say, so at the hospital, at Providence Hospital, we have community health and a community health improvement plan. And so our priorities for 2021 and 2023 through that time span, our first priority is housing instability and homelessness. Second priority is mental health and substance use. Third priority is health equity, racism, and discrimination. And our fourth priority is access to healthcare. So that gives you an idea of the overall arching framework from which we're working in. I'm going to focus, of course, on behavioral health and the work that we've been doing in our community health investment department. There's a lot of really amazing humans doing a lot of wonderful work. In the Community Behavioral Health Partnership Program, the This program really focuses on access to care. And so we're really looking at the entire system of care across system and service. So that includes hospitals, health centers, substance use, community-based organizations. In behavioral health, we include mental health and substance use, as well as social supports, and homelessness falls inside of that because we're talking about social determinants of health. So we're really looking at where in our system of care can we all come together and work together to increase access to care. And I was definitely brought onto the team because I am a system analyst. So I look at our larger system and I look at how someone moves through our system of care. And this is across any age group. So this is across our lifespan. So from little tiny humans, 0 to 5, all the way up to seniors. And we have, as we all know, a very complicated and challenging system when it comes to mental health, substance use, and trying to have access to care. So I only want to focus on a few ways we're doing that because I could talk a whole novel around that. And we have several programs that focus on different areas. So for example, we have substance use navigators at both Memorial and Petaluma Valley Hospital. And those substance use navigators support and help people have access to care when they come in contact with our hospitals that have a substance use disorder. We have our mobile health clinic that is a primary care free mobile health clinic that goes throughout Sonoma County, and their role is to support access to primary care. However, they also support connecting individuals to our community resources for behavioral health. The Sonoma Connect initiative that we have, you may have heard of that. That really focuses on building out a network of care around trauma-informed ACEs screening and works with our community across the system, like I just said, health centers, hospitals, schools, how there's several different action teams in a part of Sonoma Connect. And they're talking about how do we best look at resources and what kind of resource platforms should we be using in order to do closed loop referrals? How do we do ACEs screenings in a trauma-informed way? How do we work collectively across the system in order to increase access to services? And really that work is focused all around the trauma-informed ACEs screening and then having people have access to care. I will send you, Tori, I'll send you the fact sheet around Sonoma Connect so people can get connected if they want to be a part of that work. The other work that we are doing is the Care Network team. And so our Care Network team is a team that works directly with individuals coming out of our hospital systems. And that team is social workers, nurses, and community health work. And what they do is they wrap support around different individuals. So for example, we have a high utilizer team that works with individuals that are circling in and out of our jail system and our mental health system. And they work with individuals to get them connected to support and services. That could be anything from medication. One of our nurses might help support someone to have access to medication. Our social workers might help somebody if they don't have access to housing. And so we get them connected and make sure that they have the right level of care. We do a lot of community education. So one of the other big areas of our community behavioral health program, partnership program, is education. And so like Kate was talking about, we bring in a lot of different individuals to provide education around trauma-informed care. We bring in peers to have conversations with inside of our community meetings to talk about language. We encourage people to become educated about harm reduction. We want people to have access to the education they need in order to provide a equitable, inclusive, and recovery-oriented support throughout our system of care. How we engage with people is super important. If someone engages with any part of our system and there isn't a welcoming access point and they don't feel like they can connect, they're not going to access care, especially if we're talking about behavioral health or social supports. It's really a hard area to want to reach out and get support. So we want to make sure that people have the support and the education in order to make those connections and be able to people to have that human response when they're connecting with the people that we're serving in our community. One of the big areas that we did this with is suicide prevention. we did a 2 years in a row, we have done a Path to Hope Live community event that's focused on suicide prevention. I can drop the information in the chat for that as well. This year we focused on our youth and we had 5 different events. And the big thing that we did with this event that I was super proud of is that one of the things that we do is we assess and meet the community where they're at as far as our providers and what our providers are saying that the community needs. And one of the largest things we kept hearing is around language and the importance of having information in your own language, specifically with the Latinx community and having to talk about mental health when English isn't your first language. And so we brought in a social justice language translator to actually provide translation in common Spanish. And so that was really a big deal because if you're talking about mental health and you're translating in a verbatim translation, you miss a lot and you don't actually get to understand what someone is trying to say to you. And we really feel like that was well received with the community. We got a lot of feedback about how important that was and how the community was able to be more a part of that event. In that event, we served unduplicated 809 individuals showed up to those 4 events, which is kind of amazing in a time of a pandemic when people are really tired of Zoom. And the total attendance was 2,100. So we had a lot of individuals that came to all of the events. The other area that we are doing a lot of work is around coordination of care. And so we have several different meetings that we focus on system coordination of care across different areas. And one of those meetings is our community transition of care. The other one is our housing as healthcare collaborative. And the third is our community partner connection. I will drop in the chat those different meetings. This is definitely a way that you can get involved and you can be a part of supporting our community to have the right level of care at the right time. So one of the biggest focuses with what we're doing is really trying to right size level of care. So if we have a system that is siloed and isn't working very well, then we are the community solution. And so we have been working across our system and supporting individuals to come together with us to actually be able to be that bridge. So if we are in a hierarchical system, right, people don't know how to have that access because there's gateways and you have to jump through all these hoops. If there's a network and people are working together, then we actually create the support system underneath individuals that we're serving. This not only supports the individuals that we serve, it also supports the providers. Providers are equally as tired trying to get access to care. I mean, you hear that across the system. You know, we are working really hard. We are trying our best. And so the more that we work together, we can work effectively and we can get people to the right level of care, which is what we really want, and in a very kind and human-centered way. And I'm happy to answer any questions, but I think I will stop there.
Oh, thank you so much, Erica. I think most of us who've been working in this field, even for the shortest time, will be that at some point we'll end up talking to Erica. She is just very well connected and has been doing this work a very long time. And we really appreciate you and thank you very much for being here this evening. Providence.
Thank you for having me. I'm happy to serve with you all. Thank you.
Yeah, and Providence has definitely stepped up to the plate in a lot of support for new ways of doing things. So we all appreciate that. Okay, so our next in little boxes is Sean Kelson. Thank you for being here and welcome.
Thank you. Hey. Yeah, I'm Sean Kelson. I'm the West County Community Services Program Manager that oversees the Petaluma Peer Recovery Center and Interlink Self-Help Center. Yeah, Petaluma Peer Recovery Center, or PPRC, is a peer managed and operated mental health self-help recovery program offering drop-in and virtual services. Mondays and Wednesdays, we're open from 10 to 3. closing down for in-person services for sanitizing at lunch from 12 to 1. And we also field warm line calls during that time. On Thursdays, we're open from 10 to 1. All of our services are free and available for adults in our community seeking mental wellness support. We're very happy that we have been able to host participants on site at PPRC since the beginning of the fiscal year and continue to enjoy being able to utilize the outside space, as some participants have preferred to meet outside rather than come into the center, mostly due to COVID. We offer opportunities for connection in the form of groups, socialization and art activities, one-to-one support, and help with community resources. We also offer a monthly forum. Our morning check-in group has been the most popular group this quarter, followed by calming our anxiety group. And besides having folks come into the center, we continue to, like I said, provide warm line support, as well as one-to-one Zoom support to participants. Yeah, some participants request that we use curriculum from our groups for one-to-one sessions, and others prefer focused check-in time. And so some of our participants utilize all of our offerings. Some only visit us virtually and some only come in person. It's been great to be co-located with Sonoma County Behavioral Health and the Human Services Department. We have again been getting some referrals from these entities now that more in-person services are being utilized. And our new assistant manager, Lynn Cessna, a graduate of the peer support specialist class, is a great addition to the team and has made some great connections. She comes with a lot of experience, including having been an eligibility worker herself. Yeah, it was fun going over to Human Services, and they all just started talking, having a lot in commonality of providing support, and made a really nice connection over there. We're looking to expand our one-to-one Zoom offerings to be able to provide connection and support for more individuals who experience barriers to coming into the center, including transportation issues. I thank you for the focus on Petaluma this month. If we were all here in person, we would have been offering tours, but hopefully we'll be able to do that again before too terribly long. And thank you for your support.
Well, thank you, Sean. Excited to know that there is our outside space being used. That is awesome. And so thank you very much. That is awesome. And also just to remember that Petaluma Peer Recovery Center, one of several peer centers in Sonoma County. So we are very lucky to have our very own center here in the South County. And thank you very much, Sean, for giving us those highlights.
Thank you.
Okay. Yeah. So I am looking at the folks that I can see, and just want to make sure that I don't have anyone in our audience that is a panelist. So if you are a panelist, if you could, if they raise their hands, can you see them, Tori? So if you can raise your hand if you are in the audience and you are a panelist. Okay, so I don't see any more hands. So I think that we have everybody who is a South County service provider has had an opportunity to talk. I'm not sure if we have time for questions at this point, because we kind of moved on quite quickly from one to the next.
If there are questions, go ahead and take them.
Okay, so are there any questions at this point? No? Okay, well, thank you very much to
Yes.
Yes, okay.
Yes, I'm a little hand up.
Kate. Sorry.
I've just been sitting here and I am so impressed with everything I've heard. It just sounds like one wonderful program after another. And I mean, I feel that way a lot, but you just all sound like you're just doing wonderful work. So thank you.
Thank you, Kate. Okay, well, I would like to just say everybody who came and talked about our programs, we are very excited about all the services that we do have here in South County. And I will hand it back to Kathy.
Okay, and I will echo again what Kate said, that the programs in South County sound wonderful. It sounds like people are really working together to make it a smooth and seamless presentation of services. Of course, you know, there's always room for more, but excited to hear what's happening there. So I want to take go a little bit out of order because we did not have a quorum when we started the meeting, and we do now. Annabelle and Betsy are now here. So I would like to, I know that you've had an opportunity to see the October 19th minutes, and I would like to entertain a oh my gosh, my words are failing me. A motion to approve those minutes.
Okay.
I motion.
I'll second.
So Betsy motioned, and who seconded?
I did.
Thank you, Bob Cobb. So all in favor?
Aye.
Okay.
Aye.
Any opposed? Any abstentions? Okay, so the minutes are approved. Thank you very much. Bill Carter, do you have a report? Your last report to the Mental Health Board.
Yeah, so I'll offer just some updates. I think the primary one was related, Kathy, to what you reviewed earlier in the meeting. So we had announced that there was a selection of a Department of Health Services director, and that gentleman withdrew his application, given his concern about what he had learned about the resignation of the director of the Development Board and the general treatment of individuals of color in Sonoma County. So we are waiting to hear from the board regarding next steps for resuming that recruitment. We don't know if there was a number 2 in the process who they can offer to, or if there's a need to do more recruitment. So we are waiting for that information. I had prepared an overview for the board today on CalAIM. Did not do it because the redistricting conversation took the entire meeting. But if you don't know, CalAIM is a very broad and deep reform of the Medi-Cal system. It's going to have a fairly significant impact on mental health and substance use disorder services system. The changes will take place beginning in January and through 2027. And I encourage you, if you're somebody who follows the system and the changes that are upcoming, to look for information about that. And you may want to invite somebody to a future board meeting to offer an overview of that. Looking at my notes here, we're expecting the PUF contract to come to the board in December. We're looking for an opening in January. As far as we can tell, the only thing that would delay that is difficulties with hiring. So we know that the labor market is tough right now. It's difficult to hire in all areas, but in particular, areas that around nursing and client care positions. So we will be, following with them their progress in that area, keeping our fingers crossed. One of the MHSA oversight and accountability grants that I've spoken about earlier went to the board today, so that this project will now move forward. This is the Mental Health Student Services Act. It was a project submitted by the Sonoma County Office of Education to provide enhanced mental health services on school campuses and to create a liaison with the Behavioral Health Division to help children, youth who have higher levels of need access services through the standard county programs. The board has announced it's going to appoint the Measure O Oversight Committee at the December 14th board meeting. Keep an eye on the calendar. Those calendars change, but several in the audience have asked about that in the past. So I wanted to let you know that's moving forward. We've also made some progress on the jail diversion project we've talked about in the past. That's a project that relies upon two funding sources. One is a grant from a state entity called CHAFA to purchase a property. And the second is permission from the Mental Health and Services Oversight and Accountability Commission to invest MHSA innovation funds in the program that would support that. One of the big barriers has been finding an appropriate property. We believe we have found that and can now move that project forward. And Melissa Ladresh is in conversations with the OAC regarding the program funding that has been very positive to date. Those are the updates I will offer you tonight.
Okay, any questions for Bill? Is your hand up, Bob Cobb?
Sorry, no. I was just resting my head.
Okay. Anybody else? Okay, I'm not seeing any questions. Well, it is now time to honor you, Bill Carter. And I do not have your certificate written up yet because I'm still thinking about how to fit everything on it that we appreciate about what you've done in this time that you've been here. You came at a time that the behavioral health system was beginning to recover from a real hard time, and you have your kindness and gentleness and appreciation for what people in the system, either employees or those that are being served, you're just so genuine, and it's very much appreciated. I very much have appreciated working with you. So that's, I'll fit more onto your certificate. I have to think about that one still, but yeah, I'm going to give anybody else have something that they would like to say to Bill.
Bill, this is Mary Ann. I would just say thank you very much for your service. I think you've helped make a major turnaround and improvement in a much needed system in this county. Make all of us social workers proud that you're there. Thank you.
Thank you, Mary Ann.
Bill, I wanted to acknowledge that I think overall, through all the things you've done, you've brought a sense of stability and movement forward in the process from the time which you entered this arena. And so you're well appreciated for that effort.
Thank you, Bob.
Erica, I think, has her hand up.
I just want to say thank you so much, Bill, for the consistency, the transparency, and being a calm after a big storm, and really supporting us all to collectively move together. One of my favorite things is how much more collaboration is happening and how much more we're all working together to braid funding and to work towards access across our system of care. And your leadership really was a big part of that. So I really appreciate that. And I think that that should continue as we move forward. And I'm definitely going to miss you. So thank you so much for being a part of our services and helping us.
I think I see that Chris.
Yes. Thank you for the opportunity to speak. I too, as Erica suggested, appreciated Bill's collaborative reaching across the aisle, actually having direct discussions about how to create systems that work for the people that we serve. So your leadership and your guidance will certainly be missed. And also wishing you some fun in retirement as well. After all of this and COVID and fires, I hope you relax and take it easy. So thank you.
Oh, thank you, Chris.
Betsy.
Yeah, I guess I only wish that I could work alongside you a lot longer than I have, Bill. I think I echo Erica's sentiments that I really appreciate the transparency. I think that we need much more of that in the countywide, and I really do appreciate your just thorough reports and your ability to bring us in, reel us in terms of information, but also in collaboration. And I just hope we get to have more of that with whoever comes on next. I'm sorry that you aren't able to train anyone or have someone work alongside you before you leave. It sounds like we are not having much success there. So a lot of, I'm sad to see you go. Thank you for all you do.
Carol.
Yeah, also a big thank you, and we're happy for you to have a short break and happy times with your family, but we want to recruit you back. Being reconnected with us in whatever shape or form feels good to you. But just want to appreciate the learning that you were willing to, or the teaching that you were willing to do in terms of what was possible for peers particularly. I know we kind of got ourselves, well, I'll speak for myself, pretty wound up about the MSHA funding. And I do believe that there is some move afoot to reinstate MSHA funding in the not too distant future, but that is not the only way, that there are multiple other avenues. And if we look at the whole system and look as they come up, I think certainly that's been something that I've learned from you, that there are creative ways to kind of change the system as opportunities arise. So really, thank you very much for your patience. And we'll miss you. And thank you.
We definitely want you to have fun and enjoy your retirement. And I'm going to again admonish you, be careful, because it's easy to fill up that time with things that are that keep you busier even than when you were working. So we wish you the best. We wish you were here longer, but happy that you're getting the chance to retire and enjoy yourself. So.
Well, thank you again, Kathy. It's moving to hear such kind words from a group of people I respect so much. I think that means a lot. And I think one of the hardest parts of making the decision to retire is disconnecting from, on some level, from a group of people like this and the people that I work with here and at the department. It's that being a part of kind of community is what's energized me for so many years. Now that I'm making this change, I know that I'm going to miss this, and I'm going to have to seek out ways to replace it because it's so important. Thank you all.
And thank you. And we're going to definitely miss seeing you. So
If you need anything to do in retirement, you can call me, Bill.
yeah, well,
I have a few ideas.
Okay, thank you so much. So we're gonna move on to the next item. This moment in the agenda is for committees and connection with the the bigger mental health system. I don't think that we have any committee work to necessarily report on tonight, but there is one big important thing that I'm going to put right into this space, and that is that the data notebook that we are supposed to be working on every year, our county plus all of the other counties are working on this data notebook, and it allows the system to be examined in a bigger way. And it's important for us to do our part to fill out the data notebook and get it done. I asked for volunteers to meet with me and a couple of other people, and I ended up being there. Thank you, Tori was there, and Susan Castillo and Chris Marlowe. So it was just the four of us. I am not the mental health board. So the mental health executive committee, mental health board executive committee is now going to have a meeting in December 1st. And at that meeting, the agenda is going to be fill out the data notebook. So there are 8 of you here tonight. That's just a couple people missing. Please show up on December 1st at the executive board meeting so that we as a board can have our input on the data notebook. So that's a request, demand, whatever. Be there. Okay. We have a new peers representative from the JC. And so I would like to introduce Maddie Cottrell.
Hi, I am Maddie. My pronouns are they, them. I am a student at Santa Rosa Junior College, and I'm a member of the Peers Coalition intern team. Yeah, I am excited and a little nervous, throwing that out there up front. A little bit about me. I practice a pretty extreme authenticity. I don't waste a lot of energy trying to be someone I'm not, and that is a thing that we that comes really handy in working on campus and trying to destigmatize the needs of students and services for mental health. So that's me. Kind of a broad overview I'll start with real fast. So you may already know this. The California community colleges in general are experiencing a pretty significant dip in enrollment. Santa Rosa Junior College is no different. We are facing some very low enrollment numbers, and student engagement as a whole has been pretty drastically affected. So on a more specific note, what is Peers Coalition? I wasn't sure if everyone was familiar or is familiar, so I kind of just expected to kind of run through a basic understanding of what we do and who we are. So the Peers Coalition works with the Student Health Services, is a part of their program on campus, and our main focus is reducing stigma and increasing student access to mental health support through that reduction of stigma. So my job in particular is a lot of talking about my own mental health and creating space for other people to do the same. So, you know, we take a peers model. We are all in this together as students, and I actually took the job expecting a little bit of a different definition of peer, which you all are probably more familiar with. I am a person who's done advocacy work and peer-to-peer health work for several years with the National Alliance on Mental Illness and a number of other organizations. So I actually jumped into this job thinking like, oh, I'm going to go do my usual. I am a person who suffers, and I'm here to talk to other people about how they suffer and get them support. And then found out very quickly that for us, peers is just student. It's just a student on campus, off campus, and we are acknowledging that we're all in need, which is something I really, really love about the work that we're doing. Part of destigmatizing mental health is acknowledging that being well is not a state that is a permanent and normative state that we begin in. The same way that being unwell is not a permanent state of something outside of the norm. A lot of the work that we're doing right now, especially given this pandemic and given the circumstances that everyone finds themselves in, turns out like material needs and material stuff really matters. Students are wearing lots of different hats and are struggling to navigate, kind of a whole new world. As peers, as this team, we are also doing the same, trying to understand, some of the flaws in language, some of the flaws in approach that exists in a bigger systemic level, and also looking at new techniques that we can engage with students in this whole new time and place and world that we're in. This week, actually tomorrow, we have a workshop that we're doing on campus that is a community brainstorm that is hoping to bring students and faculty together to talk about some of the accessibility needs that we've actually gained through this experience with COVID. Zoom is something that we're all really, really tired of, and is something that has actually increased accessibility for some students in some ways. So, looking at that, trying to change the overall narrative about what it is to live with symptoms, what it is to struggle with mental health. We host just kind of some of the things we do regularly. We host bi-monthly, well-being Wednesdays, which are single topic workshops that bring students together into a community space for safe dialogue and to connect with resources. And all of the work that we're doing is also partnering with other student organizations. Without a physical space, being on campus regularly, which is starting to open up a bit, it's been very difficult for us to not only reach out to students and find where they are, but also bringing them in to the events that we've done. So historically, we've been a pretty, I think, event heavy concept. And now we're expanding that to start actually like being present in things like student clubs. So attending students for recovery clubs, attending SGA meetings, actively engaging and promoting our services in the spaces where students are already going to be, to try and reduce some of the work that people that students are already having to do and kind of get to where they are. Yeah, so that's a little bit about who we are, what we do, and if there are any questions, I'm happy to answer. If I missed something, please let me know.
Okay, I'm not seeing any questions. I'm welcoming you. I hope that we see you every month. The executive meetings are also public meetings, and you're welcome to be there as well as you, if you wish, but certainly you have a place to speak on each agenda each month. So welcome to the board. We look forward to hearing from you again.
For having me.
And thank you. You know, the Peers Coalition has been a part of the board, but it's been a long time since we've had a real description of what you do. So thank you for that as well. So I'm going to go ahead and end the meeting unless anybody else has something to discuss, with reminding people that we have openings in District 2, which is Petaluma area, District 4, and District 5. And I know that the county is looking at redrawing the district boundaries, so I'm not sure how that's going to affect our appointments. But in the meantime, there are those 3 areas that are open that we could use another board member. Did anybody have any discussion that I have missed? Okay, so
Kathy, Bob Cobb here. I
Yes,
had
Bob.
a couple of quick things. I was going to welcome Maddie also, but I had a question for you. Was there something in your recent posting about the data notebook that there was an extension requested?
There was an extension requested because it was due November 30th. But when we met, we really felt like it was more important for more people from the board to have input. And it is actually an opportunity for the board to be educated on the topics within the data notebook as well. So we decided it was only a 1-day extension really that we were asking for. Well, maybe a couple of days, because it might take, you know, a day to get that, get it input. But so we did decide to request that extension so that we could get more board input.
Thank you.
Mhm. Any other questions?
One final comment I have, Bill, one of the things that I'll miss from you in these Zoom meetings, going back to the early ones, are the signs that filled your wall behind saying, you're muted, can you hear me now? And things of that sort. So I'll always remember what the background on your screen was.
Yeah, we're going to miss your smiling face. So that's a good statement to end on. We're going to miss your smiling face, Bill. So with that, do I have a motion to adjourn? Carol made that motion to adjourn. Is there a second?
I second.
Betsy seconds. I will see you all on December 1st. Thank you and good night.
Thanks, everyone.
Enjoy your retirement, Bill.